Okay, welcome back to the deep dive. Today we're tackling something incredibly common, maybe too common, in our pets. Periodontal disease in dogs and cats.
Yeah, it's a big one.
You've brought a really detailed source here. Seems like a proper deep dive into, well, everything. The anatomy, how it develops, what to look for.
Right, how vets diagnose it, stage it, the treatment options, and importantly, home care too.
So our mission today is to unpack all that, cut through the technical stuff, and pull out the key things you need to understand about this kind of sneaky problem. Let's get into it.
Sounds good.
All right, let's start simple. What exactly is periodontal disease? People hear the term, but what are we actually talking about?
Okay, so it's inflammation, right? But it's not just the gums, the gingiva.
Okay.
It affects the whole support system for the tooth. We're talking the gums, yes, but also the cementum covering the root, the little fibers, the periodontal ligament holding the tooth in the socket, and the bone itself, the alveolar bone.
The whole foundation, basically.
Exactly. The tooth's entire support structure.
Yeah.
And that's the critical difference from just gingivitis.
Right, I was going to ask about that.
Gingivitis is just inflammation of the gum edge, the marginal gingiva. Periodontitis, though, that means there's already been some damage, some loss of that attachment tissue.
So attachment loss is the key distinction.
That's the critical point. Once you have attachment loss, you're into periodontitis territory.
So how does this whole process, this destruction, actually begin?
Well, it's basically a bacterial thing. The mouth has defenses, saliva flow, cell turnover.
Okay.
But there are always bacteria hanging out, especially in that little groove, the gingival crevice, where the tooth meets the gum.
Okay.
It starts really simply. A clean tooth gets coated in this thin film, a pellicle. It's made of proteins, just stuff from saliva and the fluid that seeps from the gums.
Like a primer coat.
Kind of, yeah. And this pellicle attracts the first wave of bacteria, mostly aerobic ones, the kind that like oxygen, think actinomyces, streptococcus.
The early arrivals.
Right. Then more bacteria stick to them, and you get this buildup we call plaque, just a soft, sticky film.
We've all heard of plaque.
Exactly. But if that plaque isn't removed, say, within days, minerals from the saliva start getting deposited into it. And it hardens.
Into tartar.
Into calculus, or tartar, yeah. And calculus is rough, like little bits of concrete on the tooth. It really irritates the gums just by being there.
Okay. Still sounds mostly surface level, though annoying.
But here's where it shifts gears. As that plaque and calculus build up, especially creeping under the gum line.
Into that pocket.
Precisely. It creates an environment down there that's shielded from oxygen. An anaerobic environment.
Okay.
And that allows a whole different crew of bacteria to thrive. The anaerobic ones. Things like bacteroids, porphyromonas. There are specific species like P. gulae that are bad news. Prevotella. Fusobacterium in dogs.
Different bacteria for cats.
Slightly different mix, yeah. Cats often have Peptostreptococcus, actinomyces, porphyromonas too, but the key is they're anaerobic.
And those are the really destructive ones.
That's the core of it. These anaerobic bacteria, they release endotoxins and other nasty byproducts. And those toxins are what really trigger significant inflammation and tissue destruction.
So it's the toxins causing the real damage.
It's the toxins and the host's own inflammatory response trying to deal with them. It's like friendly fire almost.
Right.
The immune system tries to fight the bacteria, but the enzymes and chemicals it releases end up destroying the periodontal ligament and the bone.
Wow. So the body's defense contributes to the problem.
In a way, yes. It's this imperfectly balanced host-parasite interaction, as the source puts it.
Okay, so this is happening below the gum line, actively eating away at the tooth support because of these specific bacteria and the body's reaction.
Exactly. And, another interesting point the source makes, while it's primarily an oral disease, they've found microscopic lesions, tiny changes in organs like the liver, the kidneys, even the central nervous system in some animals with periodontal disease.
Seriously, like the bacteria spread.
Well, the link isn't fully proven to be direct cause and effect in all cases, but the association is there. It could be bacteria getting into the bloodstream or just the chronic inflammation having systemic effects. It raises a really important question for you as a pet owner.
Yeah.
How much does oral health really connect to overall systemic health? It suggests it's potentially more than just a mouth problem.
That is eye-opening.
Yeah.
Definitely more than just bad breath then. So how common is this? Are certain pets more likely to get it?
Incredibly common, especially in dogs.
Right.
Very, very prevalent.
More than cats?
Yeah, less common in cats overall, but still a significant issue for them too.
Okay.
It definitely gets more common as pets get older, just more time for it to develop. but there's no real difference between males and females.
What about breeds? Does that play a role?
Absolutely. The source highlights breed predisposition. Toy breeds are, let's say, particularly at risk.
Right. Which ones?
Maltese, Yorkshire Terriers are mentioned specifically. Often it's because their teeth are just crowded into those small jaws.
Ah, crowding makes it easier for stuff to get trapped.
Exactly. Harder to clean, more places for plaque to hide and build up. But crowding isn't just a toy breed issue. It can happen in others, too.
Any other risk factors?
Yeah, besides crowded teeth, dogs that groom themselves a lot, sometimes they can embed hair up in the gum sulcus, which is irritating.
Interesting.
Also, other underlying illnesses, anything that weakens the immune system, or even just a poor nutritional state can make them more susceptible.
Okay, so if it's often hidden and potentially linked to bigger issues, what signs might an owner actually notice at home?
Well, the classic one everyone thinks of is bad breath, malodor.
Right, doggy breath.
But usually by the time the breath is really noticeably bad, the disease is probably already quite advanced.
Ah, okay, so it's a late sign.
Often, yes. Other things you might see, maybe rubbing their face, pawing at the mouth, sometimes dropping food when they eat, or you might notice a bit of blood on chew toys or around the mouth.
Okay, those seem more obvious.
They do, but here's the kicker, and this is really crucial for you to understand. The degree of disease varies hugely by tooth. An animal can have perfectly healthy teeth right next to one with stage 4 disease.
Wow, really?
Absolutely. And those visible signs, they often don't reflect the true extent or severity of what's happening across the whole mouth, especially below the gum line. A pet can seem fine and still have significant problems brewing.
Right, so if the outward signs are unreliable, how do vets really figure out what's going on? How do they diagnose it properly?
This is a huge takeaway. Just looking in the mouth while your pet is awake, the visual awake exam, it significantly underestimates the presence and severity of periodontal disease.
So just lifting the lip isn't enough?
Not even close. The source is clear.
Yeah.
There's basically no correlation between what you see on an awake exam and whether disease is actually present or absent underneath.
How much are we talking? Like, how much is hidden?
The number quoted is as much as 60% of the disease is below the gum line, hidden from view.
60%. Okay, that's staggering.
It is. Think of it like an iceberg, right? You only see the tip.
So how do they see below the waterline, so to speak?
Right. It requires examination under general anesthesia. That's the only way to do it safely and thoroughly. And the two main tools are dental radiography and periodontal probing.
X-rays, basically.
Exactly, dental x-rays. They are absolutely essential because they show the bone structure around the tooth roots below the gums.
What do they look for on the X-rays?
They're looking for bone loss.
Yeah.
Is the bone level lower than it should be? Is the bone density reduced? In later stages, you might see bone loss specifically where the roots fork in multi-rooted teeth that's called furcation involvement. These signs start showing up around stage 2 or 3.
Okay, X-rays see the bone. What about probing?
Periodontal probing uses a tiny measuring instrument, like a miniature ruler with millimeter markings.
Okay.
The vet gently slides it into the space between the gum and the tooth, that sulcus or pocket. They measure two things: the probing depth, how deep the pocket is from the gum margin, and the attachment loss.
Attachment loss. How's that different?
Attachment loss measures from a fixed point on the tooth, the cemento-enamel junction, where enamel meets root down to the bottom of the pocket. Normally, the gum attaches right at that junction, so any measurable attachment loss means the supporting structure has been damaged. That's abnormal.
Got it. And what are normal depths?
They're tiny. In dogs, generally, anything over 2 or 3 millimeters, depending on size, is considered an abnormal pocket depth. In cats, it's even less, maybe over 1 millimeter.
Wow, very small margins.
Very small. It highlights how subtle the early changes can be. There's also a quick screening test mentioned
Oh, yeah?
called OraStrip Quick Check. It's a little strip test vets can use maybe during a regular checkup on an awake pet. It detects certain sulfur compounds, thiols, that are produced by the specific bacteria involved in periodontitis.
And it tells you if they have it.
It gives a result in about 10 seconds. A positive test strongly correlates with the presence of periodontal disease and would usually prompt the vet to recommend a full dental exam under anesthesia to find out exactly how bad it is. It's a screening tool, not a definitive diagnosis of severity.
Okay, so X-rays, probing, maybe that strip test. That's how they assess the damage. And you mentioned staging. How does that work?
Yes, staging is crucial. Vets use a system, usually PD0 to PD4, to classify the severity for each individual tooth. Remember, it can vary tooth by tooth.
Right, so what are the stages?
PD0 is basically normal, healthy, no inflammation, no attachment loss, perfect.
Okay.
PD1 is gingivitis. You've got inflammation, the gums might be red, swollen, maybe bleed when probed, but crucially, there's no loss of that underlying attachment. The bone height is normal.
So reversible at that stage?
Generally, yes, with professional cleaning and good home care. Then PD2, that's early periodontitis. Now, you do have attachment loss, but it's less than 25%.
How do they measure that percentage?
Either by probing the attachment loss or looking at the x-ray and comparing the amount of bone loss relative to the total root length. You might start seeing early bone changes on the x-ray, maybe slight furcation involvement.
Okay, stage 2, less than 25% loss. What's next?
PD3 is moderate periodontitis. Now we're talking 25 to 50% attachment loss. The damage is more significant, more obvious bone loss on x-rays, maybe more definite furcation involvement.
Getting serious?
Definitely. And then PD4 is advanced periodontitis. That's more than 50% attachment loss. Often there's significant bone destruction visible on x-rays. It can be horizontal loss, vertical craters next to the root, or oblique patterns. You might have severe furcation exposure where you can pass the probe right through between the roots. The tooth is often becoming unstable at this point.
Okay, so that staging really maps out the progression. And I assume the treatment depends heavily on the stage.
Absolutely. The stage of disease for each tooth dictates the treatment plan. The ultimate goal, though, is always to eliminate those infected pockets and stop further attachment loss, if possible. And treatment success also depends on, well, having a cooperative patient, but maybe more importantly, having a client, an owner, who's willing and able to provide the necessary follow-up home care.
Right, that's a big factor. So what are the treatments for these different stages?
All right, for the early stages, PD1 gingivitis, PD2 early periodontitis, the core treatment is a thorough professional cleaning under anesthesia. That means scaling to remove all plaque and calculus, both above and below the gum line. That subgingival cleaning is key.
Getting into those hidden areas.
Exactly. Then polishing the teeth to make the surfaces smooth, which makes it harder for plaque to stick again. And finally, irrigating or flushing out those pockets. Sometimes a sealant like Sanos might be applied afterwards.
Okay.
For pockets in stage 2, sometimes vets will place locally applied antimicrobials directly into the cleaned pocket, things like Clendoral or Doxarobe gel. These can help reduce pocket depth when combined with daily home care afterwards.
What about stage 3, the moderate stage?
Stage 3 usually requires everything we just mentioned, plus more intensive cleaning below the gum line. This might involve procedures called closed root planing and the subgingival curettage, basically carefully scraping the root surface and the pocket lining to remove diseased tissue and bacteria.
Sounds more involved.
It is. And for stage 3, if good home care isn't going to be possible, extraction of the tooth is often a serious consideration to just remove the source of chronic infection and pain.
And stage 4, the advanced cases.
Stage 4 is tough. Often it requires surgery or extraction. If the vet thinks the tooth might be salvageable, they might do surgery to open up a flap of gum tissue.
Like peel the gum back.
Yeah, to get direct visual access to the root surfaces and bone defects for really thorough cleaning and treatment. This is called open flap curettage. But the source notes the prognosis for saving these teeth is often guarded, meaning uncertain.
So extraction is common for stage 4.
Very common. It's often the most predictable way to resolve the infection and pain associated with such advanced disease. There are also other complex surgical procedures, different types of gum flaps, bone grafting materials for certain types of bone defects, guided tissue regeneration using special membranes, but these are more specialized procedures usually done by veterinary dental specialists.
Okay. What about antibiotics, like pills?
Good question. Systemic antibiotics like clindamycin or amoxicillin clavulanate are approved for treating periodontal disease. But, and this is important, they are generally not used as a standalone treatment.
Why not?
Because they don't fix the underlying problem, the plaque, the tartar, the deep pockets, the damaged tissue. Antibiotics might temporarily knock back the bacteria, but as soon as you stop them, if the environment is still there, the bacteria just come back.
So when are they used?
Typically, they're used short-term in conjunction with the definitive treatment, which is usually the cleaning and any necessary surgery under anesthesia. So maybe a short course before the procedure, during, or for maybe 7-10 days afterwards to help manage the bacterial load during the treatment and healing phase, not as a long-term solution on their own.
That makes sense. Treat the cause, not just the symptom. So the vet does the heavy lifting under anesthesia. What about our part? What can we do at home?
Home care is absolutely critical. It's really the cornerstone of preventing the disease in the first place and also essential for slowing down its return after professional treatment.
Okay, what kind of things work?
The source mentions the Veterinary Oral Health Council, the VOHC. You should look for their seal on products.
UHC. Okay.
Yeah, VOHC. They accept products that have scientific evidence showing they significantly reduce plaque and/or tartar accumulation, usually by at least 20% compared to standard dry food.
So that seal means it actually does something.
It means there's proof behind it, yes. Brushing your pet's teeth daily is still considered the gold standard for physically removing that plaque before it can cause problems.
It's daily brushing.
Yeah.
That sounds challenging for some pets.
It can be, but even a few times a week is better than nothing. But there are other options too. The source mentions specific ingredients and product types.
Like what?
Fluoride, specifically stannous fluoride preparations, can help control plaque and decrease tooth sensitivity, which is useful if roots are exposed in later stages.
Okay.
Chlorhexidine is another big one. It's a very effective antiseptic, kills bacteria, inhibits plaque, and its effect lingers, it binds to the tissues, and is released over time, up to 24 hours.
How do you use that?
It comes in different forms, rinses, sprays, gels. You can apply it with gauze or swabs. It's even incorporated into some chews. Contact time is important for it to work well.
Okay. Anything else?
There are wipes mentioned, like dentocetic wipes, that contain sodium hexametaphosphate to help remove plaque and reduce tartar. There's an Oravet gel applied weekly. And diet plays a role too hard. Viscid foods are generally better than soft food. Hill's Tedded diet is specifically mentioned as being formulated for tartar control.
So lots of options beyond just brushing.
Definitely. And the type and intensity of home care needed often depends on the stage of disease the pet has or had.
How so?
For stages 1 and 2, the recommendation is usually daily brushing or using a VOHC-accepted product daily. For stage 3, it might be daily brushing with a fluoride paste plus using a stannous fluoride gel maybe twice a week. For advanced stage 4 cases being managed, it might involve specific antiseptic gels or sprays multiple times a day.
So it gets more intensive with more severe disease.
Exactly. And one really important practical tip from the source. If you happen to be using both a chlorhexidine product and a fluoride product, don't use them back to back. Wait at least 30 minutes, maybe an hour, between them. Apparently, they can interfere with each other and reduce their effectiveness if used concurrently.
Oh, good to know. Okay, so vet treatment plus consistent, appropriate home care. How often do pets need follow-up checks after treatment?
It's tailored, really. Depends on the initial severity and how well the home care is controlling things. For mild cases successfully treated, maybe a check every 6 months as part of their regular wellness exam. For more severe cases, especially if managed non-surgically or if home care is difficult, follow-ups might be needed much more frequently, maybe every 3-6 months or even monthly in some situations.
And can they use that OR strip test for follow-ups?
Yes. The source mentions it can be used at recall appointments as a quick check to see if those bacterial thiol levels are creeping back up, which might indicate the disease is recurring or worsening and needs further attention.
Okay, so what's the overall outlook? Can periodontal disease be cured?
Cured is maybe not the right word once attachment loss has occurred because
Uh-huh.
that lost bone and ligament doesn't typically grow back on its own, but it can definitely be managed.
Managed how well?
The expected course and prognosis are highly variable. It's a multifactorial disease. Genetics, diet, home care, other health issues all play a role. But the key message is that early assessment, accurate diagnosis, appropriate treatment, and crucially, consistent long-term therapy and home care can minimize the destructive index and significantly improve the pet's comfort and health and help maintain function for a long time. Prevention through good home care from a young age is obviously ideal.
Wow, okay, that was a really comprehensive look. It's crystal clear this is far more than just, stinky breath. It's complex.
It really is. It's common. It progresses through distinct stages. So much of it is hidden below the surface, requiring specific tools like x-rays and probing to diagnose properly.
That 60% figure still gets me.
Right. And it needs treatment tailored to the stage, plus that absolutely critical ongoing home care commitment.
And the potential link, even if just microscopic changes, to organs like the liver, kidneys, CNS, that's quite sobering.
It really highlights the potential systemic implications of chronic oral inflammation.
This deep dive into the source material really underscores how vital it is for us, as pet owners, to be aware and proactive about dental health.
Exactly.
So what does this all mean for you listening?
Well, I think it means understanding that when your vet recommends a dental procedure under anesthesia, it's often not just a cleaning.
Right.
It's frequently the only way to truly find out what's going on under the gums, to diagnose that hidden disease, and to actually treat the structural problems that could be affecting your pet's mouth and maybe even their overall health.
It's about diagnosis and treatment, not just cosmetics.
Precisely.
Okay, a final thought then, something for you to mull over. If this process, starting with just simple bacteria forming a film, can lead to such significant, often hidden local destruction, and potentially have these broader systemic ripples in our pets, how might our own understanding of seemingly minor health issues in ourselves benefit from a similar deep dive approach? Questioning what might really be going on beneath the surface.